Meet Bronson. He's 38, works construction, breathes dust all day, smokes half a pack, and figured his cough would fade. Instead, after a week and a half, it's louder, thicker, and exhausting. He's got a low fever, body aches, fatigue, mild shortness of breath, chest soreness when he coughs, and a hoarse, gravelly voice. First, let's notice the pattern. The dominant symptom is a persistent cough. His sputum started clear, then became thicker and slightly colored. He feels run down, achy, mildly febrile, and uncomfortable in the chest, but not severely short of breath. On exam, lung sounds may be normal, or we might hear scattered wheezes or crackles from air moving through narrowed, mucus-lined airways. There's no single lab test that confirms acute bronchitis, so diagnosis is clinical. The key negative finding is a normal chest X-ray, telling us the alveoli are clear, and this is not pneumonia. Let's interpret. Bronson has acute bronchitis, which is a self-limiting inflammation of the bronchi, the large and mid-size airways that carry air toward the lungs. Most cases are viral. An irritant triggers the immune system, the bronchial lining swells, and mucus production ramps up. That swelling and mucus narrow the airways, activating the cough reflex. The cough isn't the problem, it's the body's attempt to clear the obstruction. Hoarseness and chest discomfort come from irritated airways and relentless coughing. The critical distinction is location. In bronchitis, inflammation stops at the bronchi. The alveoli, where oxygen exchange happens, stay functional. Oxygen levels are usually preserved, which is why this doesn't behave like pneumonia. Now let's respond. Because it's typically viral and self-limited, treatment is supportive. Fluids, then mucus. Humidified air soothes irritation. Cough relief reduces chest wall fatigue. Bronchodilators help if wheezing is present. Avoiding smoke is essential. Let's reflect. With rest and supportive care, Bronson improves over 1 to 3 weeks. The cough fades last, and smoking cessation is the single most important step to prevent this from happening again. If Bronson worsens or symptoms that persist beyond 7 to 10 days, he may need antibiotics for bacterial bronchitis and a repeat chest X-ray to rule out pneumonia. In summary, acute bronchitis is a self-limiting viral inflammation of the bronchi, causing swelling, mucus, and a cough. It is most commonly treated with supportive measures, with antibiotics reserved only if symptoms persist and a bacterial infection is suspected. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.